It is now a pleasure for 13 years old Vasilisa Puzyreva and her mother Natalia to walk along the path of the St. Petersburg State Pediatric Medical University. Just recently, here, this fragile girl accepted the challenge from the enemy who now holds in fear the whole world. A positive test for coronavirus infection is the icing on the cake for a series of unfortunate events. Firstly, a burn of legs and hospitalization in the specialized center of the first city hospital. Then, apparently there was a contact with a carrier of the virus. As a result, an urgent transfer to the infectious disease department of the Pediatric University.
There was no fear or anything like that. I wasn't scared. It was frustrating and very unpleasant that you were going to be discharged in a few hours, and this is where you realize that you have to stay for at least another week. Rather, it was very sad and hurtful.
It turned out they had to spend at the department not a week, but 3. Doctors here, seasoned professionals, treated both the coronavirus itself and the girl's most serious burns.
Vasilisa and I could only talk by phone, and she told me how they laugh with surgeons, how they laugh with anesthesiologists. You know, this is important. When a child goes to a procedure, to a painful dressing and finds the strength to smile after a while and talks about it, about jokes, about warmth, it's valuable. And I am glad that Vasilisa had fallen into such reliable hands.
Throughout the coronavirus pandemic, St. Petersburg State Pediatric Medical University was like at the forefront of treating and saving children. Therefore, the security measures here are still unprecedented. Passing into the territory, everyone has to enter such a booth. Disinfection from head to feet. Firstly, we clean feet, then hands. And further, there is a special chamber with a spray. It's better not to breathe there. During the first COVID-19 wave, in the so-called red zone, students, about 40 people, were working side by side with experienced doctors. Anastasia Gurina was among them. 6th-year student of the Pediatric University with other young physicians and experienced doctors. They were like actually living in the red zone, all for the sake of ringing children's laughter.
It's really hard. This experience will never be forgotten. The suit is hot and it's so thirsty. Certain skills are improved to perfect. It's like a javelin work. I was putting a catheter for a child without any tools, and my tourniquet fell out. I had to put it blindly with 2 pairs of gloves and try not to hurt the child. And the child is suffering and he's not feeling well.
Doctors say children carry the infection relatively easily. The exception is small patients with serious concomitant complications. But even for them, the university has already developed effective methods of treatment.
We
use the same therapy that is used in advanced clinics, in which coronavirus infection is present in great variety. These are monoclonal antibodies, and we are also considering the use of donor antibodies.
Although, according to the local infectionists, the COVID-19 epidemic has declined in Russia and St. Petersburg in particular, it is still very early to relax. A second wave is not out of question.
Unfortunately, many people do not produce a titer of antibodies which protects them when they come across the virus again. And we cannot assess how the disease will develop in people who have had this infection once. If there are protective antibodies, they protect, and therefore this infection will not be dangerous for this person.
Meanwhile, while doctors are thinking about whether there will be a second wave of coronavirus or not, our heroine Vasilisa Puzyreva is sure the key to the victory over any disease is the sharp teeth of optimism, no matter what. Like a plush shark, which girl gave as a token of gratitude to the doctors. From now on, it always meets and encourages all the new patients at the nursing post.
К нам обратилось практически 100 студентов.
Almost 100 students have approached us. They want to work in our clinic to help children. Students who say that from their primary school until they entered the medical university, they always wanted to help in a site of infection, especially dangerous one. And of course, when you hear this, you feel a great respect for our students. I told the Academic Council today that we have an absolutely wonderful team, especially students. 80% of our students help us to deal with this problem in some way.
Педиатрический университет
The Pediatric University is an educational, clinical and scientific institution for all types of care, especially for children. And naturally, since the pandemic began, the Pediatric University has been ready to receive patients. We isolated one of the buildings. We have built two security systems, the so-called green zone and the so-called red zone. I can say that other services and other ministries have been very helpful to us in separating contact patients, sick patients and patients with any pathology as far as possible. A resuscitation service was quickly set up in this building, or rather the number of beds was added. The operating theater was quickly transformed. In order to be able to receive patients not only with COVID infection, but first and foremost, the federal clinic was deployed to receive children with very serious combined pathologies.
Thermometer of employees is performed twice a day. The staff are very strictly assigned to the office, the places where they work. We switch from building to building, from office to office only when there is an emergency. We have antiseptic devices everywhere. At the entrances, in the wards, pocket antiseptics are also quite widespread. Personal protective equipment, respirators, masks, shields, protective suits is also available at the university. We have a fully checked up contingent of incoming patients. That is, they are already scheduled to arrive at the new coronavirus from PCR by order of the Ministry of Health. If they do not have one, we put them in the infectious disease department, examine, and within 24 hours we get the result. All of our students have switched to remote education. The faculty, of course, we have also switched to remote mode.
К этому надо приспособиться.
The professor is used to work for a live audience, and this encourages the professor himself. When you're just looking at a monitor, it's a psychologically different form of communication, and you have to adapt to it. What was once only supposed to be possible to use video and distance learning forms, now everyone has to learn it in a forced way, and life has forced us to move to a more modern level.
As for me, practical training should remain practical. We have to go to hospitals, get acquainted with patients, and we have to learn all this in practice. But lectures, I like the online format better because, for example, you can stay home and not be distracted by a large crowd of students. And plus, it is comfortable. You can drink tea, this way I'm never hungry at lectures. But the whole student atmosphere, which is also important, is lost.
We can't say that they were difficult. The admissions committee in principle worked in a different mode this year. It was necessary to strictly observe sanitary and epidemiological measures. The deadlines for submitting some documents and issuing orders were very reduced. But I wouldn't say that these are difficult, rather features.
По законам течения инфекционного процесса,
According to the principles of the infection process, immunization must take place either artificially or naturally. We are waiting for the vaccine. It has to be received by now. Some people have gotten sick knowing about it, some not. So the challenge is to prevent the virus from hitting everyone at one time. We have to stretch this process. That's why the most basic measures, which are not expensive, have a deep foundation. From my point of view, based on the analytics that I have, the situation should calm down completely by late spring. It will be possible to completely relax.